I'm Dr. Ken Abrams. I'm a veterinary ophthalmologist. I'm a specialist in veterinary medicine, and my patients are referred to me from general practitioners. Those clients go to their regular veterinarian with a concern about their pet's eye, and then those pets are referred to my specialty practice. I saw this bird as a patient. It's a northern goshawk. It's a hunting hawk. The owner noticed that she wasn't hunting well and couldn't see very well in her flight cage, and then also had stopped eating because she couldn't see her food. So she was referred to us for the vision problem, and he also noticed that after the bird had lost her vision, that the pupils had become cloudy.
So my very good friend, Dr. Ken Abrams, he's a veterinary ophthalmologist here at Warwick. He calls me every so often if there's an animal that has an unusual problem. Well, this one day he calls me up. He has a young gosling hawk in his office. The hawk had developed cataracts. He had cataract surgery by Dr. Abrams, and now had developed a scar tissue film in the eye, which was blocking the hawk from seeing. The hawk couldn't hunt anymore. It was having difficulty. Now, when a person gets the same condition, we have a laser that cleans that right off. Well, in birds, they don't have that same luxury. So the bird was faced with having another operation to break up that film. So Dr. Abrams said, I wonder, could we use the same laser on a bird as we used in people? So we thought we would try it. So on the given day, Dr. Abrams and the hawk's owner brought the hawk to the office. And they brought it in from the parking lot in a box. The box must have been about 2 feet in each direction. And they set it on chairs just where you're sitting now. They open the box and they reach in. Out comes the most beautiful bird you ever saw in your life. It was a gosling hawk, gray and white. And he spread his feathers and he flapped his feathers right here in the waiting room, and he was sort of crying. He was a little bit frightened, I think, for where he was. He's making this noise. We had a big crowd here watching to see what we were going to do that day. The hawk got quieted down after a while, and the owner wrapped the hawk up in a blanket and held the hawk very tightly and brought the hawk to the laser. And holding the hawk, he also held his head very still so we could focus the laser on the eye. Now, both me and Dr. Ehrlich, the two of us, were here that day, and we used a laser to use the energy to break up that film in the eye. People, you and I, have 2 eyelids. Birds have 3. Not only is there the upper lid and lower lid, but there's also one near the nose that flicks outwards to keep the eye clean. Well, we were able to put a device in to hold apart the upper eyelid and lower eyelid. But as we're doing the laser, you could see the third membrane keep flicking back and forth the whole time we were working. So we had to shoot the laser in between those blinks. Well, the whole thing took about 15 to 20 minutes to get both eyes treated. And we could see, as we were treating it, we could see the film break up. And we could see so that light could get back into the eye again. And the hawk could see much better. From what we understand, the hawk could see dramatically better after we did the laser treatment, and was able to fly again and find things again. And as we had a nice success with this little animal.